One of the things I'm most excited to be bringing back to Northwest Missouri is anterior hip replacement. So anterior hip replacement is something that a lot of folks had left our community before to go have done elsewhere, but now an anterior hip replacement can be done here in town. And most of my patients are able to go home either the same day or oftentimes the next day after their hip replacement. This procedure is a lot like other hip replacements, but by being able to do a surgery in a slightly less invasive way, it's able to have the recovery be a lot less painful and add for mobility much more quickly after surgery. So when we do a hip replacement, we resurface the acetabular components or the socket of your hip joint with a new metal cup that goes into the socket and then a plastic liner that goes in there to give a nice smooth lining that articulates your hip joint. On the femur side, or on the ball side of the ball and socket joint, there's a stem that goes down into the canal that bone grows to, so that there's no cement or anything of that sort. It becomes part of your body as the bone grows to these stems. It has a oftentimes ceramic ball that goes on top of these hip stems and then articulates with the hip joint to give you your nice new hip joint that articulates without much friction.